This is video 3 of week 5. We're going to go through the nursing process of a wound. First, we are going to assess the wound. We want to look at the appearance and approximation. So we're looking at the color of the wound, the surrounding tissue. Is there any drains present? Are there staples or sutures? Are there any wound complications such as dehiscence or evisceration? A normal wound should be clean, well approximated, light red. It could have possible slight edema, which should decrease over time. Some abnormal signs we're going to look for is red, swelling, if the wound is hot, if the wound is opening, or if there's any pus-like drainage. So let's look at some different drainages here. You have serous, which is clear and watery. That is this one right here. You have sanguineous, which is bloody. This could be bright red or dark red. It's this one right here. And then you have serosanguineous, which is pink in color, and it is a combination of the two. So you would get a light pink. And then you have purulent drainage. This is a sign of infection. It's right there. While we are assessing, we also want to look for the drains. There are different types of drains. You have a Penrose drain. There are T-tube drains. You have a Jackson Pratt, which is a JP drain. And you can also have a Hemovac. Here's the purpose and some examples. The next slide will give us some pictures. Here are some images of different types of drains that you may see in practice. Another part of the assessment is looking at your sutures and staples. These are used to hold tissue and the skin together. We want to look at what it looks like, and they can also use steri strips. We are going to be watching for signs of infection, which includes that purulent drainage, an increased amount of drainage, any kind of redness or edema. If they have an elevated temperature. We also want to watch for signs of hemorrhage, which is a drop in blood pressure, increased pulse, decreased urinary output, decreased H&H, or an increased white blood cell count. Next, we're going to be looking at the nursing diagnoses along with the outcome and planning. So, some nursing diagnoses would be impaired skin integrity, which is any condition that alters the dermis or the epidermis. Some outcomes, we would want to look at making sure it hasn't gotten any worse, making sure it has improved. To tell how things have improved would be a good thing, would be taking pictures so we can tell as we continue through the process, is it getting better or is it getting worse? Risk for infection. This is any condition that interferes with the normal inflammatory healing process or provides an entry for an infectious agent. So this outcome and planning would be the patient would remain free from infection. Some additional nursing diagnoses includes acute pain. So for our outcome and planning, we would want to make sure we are giving pain medication. Any kind of hot or cold applications could be needed. Our goal, our outcome would make sure that the patient's pain remains at a level that the patient agrees to. Patients will need to be aware that not all situations can a zero pain level be obtained. But for example, if I say that my pain level, I can tolerate the pain if it's below a 3, then that would be our outcome, is we want to maintain the pain level below a 3. I can also have disturbed body images. This happens with any kind of big wounds, or if they have to wear certain clothes. Our outcome here would be to have them accept the body image change, have them being able to dress the wound if they were able to, because some patients will not even look at their wound because of the disturbed body image. Implementing would be applying any assistive devices that would help with wound healing. These can be wound vacs, oxygen if there's a need for an increase in O2, hot or cold to increase or slow down the blood flow. You also want to look at dressings. Why do we need a dressing? What's the purpose? Dressings can help remove necrotic tissue. It can promote tissue repair. It can provide comfort. It can prevent or eliminate or control an infection. It can maintain a moist environment. It can protect the wound from further injury, and it can protect the skin around the wound if done appropriately. Wound care can usually be performed by the nurse. A cleaning agent would be the 0.9% normal saline is the most common because it's gentle to the skin. However, you can also use betadine or hydrogen peroxide depending on your doctor's orders. Supplies, again, will depend on your doctor's orders, and we'll talk about later. We are going to clean the wound according to the physician, and then before we perform any wound care, we always want to identify the self and the patient. We're going to provide for privacy and drape the patient or anything that's needed. You're always going to explain your procedure and gather equipment. You need to make sure that there is no allergic issues with adhesive tapes or the cleaning agents. You want to position the patient appropriately. We're always going to be washing our hands using a sterile technique. Remove the previous drainage, and we're always going to look at that drainage, and we would place this in a red biohazard bag. You would want to open the sterile package with clean hands, then don on sterile gloves that are in your kit. Prepare the site of the wound before the client sees it, and we need to monitor their reaction. You're going to perform the wound care per the physician's orders. You're going to obtain a wound culture if needed. These are usually done before the patient starts any antibiotics. You want to remove, after you have changed the dressing, you want to remove your gloves, wash your hands, and document what the wound looked like, including any kind of drainage, the care provided to the wound. You want to make sure you call the MD if there's a change or any kind of problems during this process. And last, we are going to evaluate. We want to evaluate if what we implemented had any effect. So, was there a decrease in the infection? Did the wound start to heal? Are the edges of the wound approximated better? Are we controlling the pain? Has it been controlled with what we're doing? Looking at any kind of anything that you implemented, this would be dressing changes, pain management. If you had body image issues, has that gotten better or has that gotten worse? Is the patient now able to look at the wound? Is the patient able to dress the wound? We're looking at anything that we have done. Has it been effective? This is going to help us know, do we continue with the same care plan or do we need to change it and reevaluate?